Let's go ahead and identify the cranial bones first, and that's going to be these bones here that are going to surround the brain. You might recall early on in class we went through the regions, and I was kind of joking around by saying if I lift up my bangs that it's full frontal nudity because this is the frontal region. So that's why this is called the frontal bone. And underneath here we also have the frontal lobe of the brain. So this whole thing is the frontal bone. Now the frontal bone, as you can see, is going to go all the way back to this suture here. This bone and this bone are both parietal bones. Parietal bones. The parietal bones. On the side, if you look real closely, I'm tracing the suture here. This bone right here is actually the temporal bone. The temporal bone. When you hear the temporal bone, I want you to think of ears. I want you to think tempo, timpani, think sound. Okay, so the ear's physically located here. But when you guys do go over the brain, the temporal lobe processes that sound information. Most people, when they have a headache, they'll go for this little area right here. And they'll say, oh, my temples hurt. The temples are not in the temporal bone at all. They're actually a completely separate bone called the sphenoid. When you're at your headache spot right here, when you're rubbing your temples, that is where the sphenoid is. And the sphenoid, I'm just going to trace it here, is just right here. It's at that point and nowhere else on the surface of the skull. The rest of the structures have to be seen inside of the skull, which we'll get to in a little bit when we peel this guy open. Frontal bone, temporal bone, the sphenoid or sphenoid bone is also totally fine. And then we have the parietal bones here and here. And in the back, I have this suture right here that looks like an upside down Y. And this is the occipital bone. The occipital bone. Now, the occipital bone is actually deceivingly large because it continues, and it's going to include all of the structures at the base of the skull. All of that is occipital bone. You might remember the occipital having eyes in the back of your head. So we also have the occipital lobe, which processes visual information that's in the back of our head. So occipital. This is also the occipital region. So let's go over the sutures that you need to know. This suture here is in the coronal plane. Okay, you might recall from way back when I was talking about having a crown. Okay, the coronal plane is going to separate you into a front half and a back half. So this is the coronal suture. The coronal suture is going to separate the frontal bone from the two parietal bones. Right, here's another view of that. Coronal suture, frontal bone, parietal bones. Similarly, this suture lies on the sagittal plane. Technically mid-sagittal because it's right smack in the middle, but we call this the sagittal suture. The sagittal suture. Remember, the sagittal plane cuts you into right and left halves. The suture that we have on the side that separates the parietal bone from the temporal bone down here, this is the squamosal suture. Now, you might remember that squamous actually means like a fish scale. So it's kind of shaped like a scale, I guess. Or I just like to think of squish squash because it's like flat on the side. So the squamosal suture. All right, the last suture you need to know is this here. This is called the lambdoidal suture. Lambdoidal, as in lambda, with a B in it. So lambda. So lambda. And the reason why this has such a weird name is it actually looks like the Greek letter lambda. So for that reason, this is the occipital bone, parietal, and this would be the lambdoidal suture. And this again is the sagittal suture. Let's start with the temporal bone. So recall, the temporal bone includes all of this here. Now it also includes this long projection here. There's a little separation here, a little suture that separates this. All of this is all temporal bone. The first structure I'd like to point out is a small hole or indentation that lies just here. This is the external auditory meatus. This is where you put your Q-tip in. External auditory meatus. External auditory meatus. This is the jawbone called the mandible. Now, the mandible articulates with the temporal bone at this point right here. So here I have the mandibular fossa. Remember, fossa means shallow bowl. This is the mandibular fossa of the temporal bone. And this is where we have the articulation point with the jaw. Mandibular fossa of the temporal bone. One of the facial bones is right here. This is called the zygoma or the zygomatic bone. This is the front part of your cheeks. So this is called the zygomatic or zygomatic bone. And the reason I'm pointing it out is because of the name of this next structure, which here, this is the zygomatic process of the temporal bone. Right, so this is part of the temporal bone, but it's called the zygomatic process because it's pointing to the zygoma or zygomatic bone. That's the zygomatic process of the temporal bone. The other one that's like that is, as you might expect, right here. This is the temporal process of the zygomatic bone. So we've got the temporal process of the zygomatic bone and the zygomatic process of the temporal bone. So the temporal bone, so far we've got the external auditory meatus of the temporal bone, the mandibular fossa of the temporal bone, the zygomatic process of the temporal bone, and the last thing we need to know for the temporal bone, we have to actually open up our brain, or I'm sorry, got brain on the brain. We have to open up our skull, and when you open up the skull, the first thing that I want you to notice, because I'm going to use this as a landmark, there's a butterfly shape, but actually I'd rather you think of it as a sphinx. So think of it as a sphinx. This is actually the sphenoid bone, okay, which is why I'm calling it a sphinx, because it's the sphenoid. I want you to think of this as the wings of your sphinx. This is the mouth of your sphinx, and these are the eyes of the sphinx. So the last structure for the temporal bone you need to know is the internal auditory meatus of the temporal bone. This is a wing. This whole thing's a wing. That whole thing's a wing. Here's one hole. So if you look at the bottom part of the wing, right under the ring, the first hole that you see there. So there's one there and one there. The way you want to find that is you want to look for these bottom ridges of the wings, and they're going to be right underneath there, kind of hiding. That is the internal auditory meatus. This is actually where the vestibulocochlear nerve is going to go through the skull to enter the brain. So the occipital bone begins here at the lambdoidal suture, and that continues to go around to this bottom view here. There's two structures you need to know for the occipital bone. The first one is going to be these structures here. There's one here and one here. These are the occipital condyles of the occipital bone. So remember, condyle means knuckle, and this one lives up to its name. They kind of look knuckle-like. All right, so the occipital condyles. The occipital condyles are going to make contact with the C1 vertebrae. So the C1 vertebrae is called the atlas. The reason that we call it that is because the atlas was the Greek god who held the weight of the world on his shoulders. So for that reason, we call the C1 the atlas. Occipital condyles. The second structure you need to know is actually named for exactly what it is. It's a big old hole. This is the foramen magnum. Magnum means big, foramen means hole. Now, you might recall that the bottom part of the brain is called the brain stem. There's no physical separation between the brain stem and the spinal cord. It's a continuous structure. So it begs the question, at what point do we stop saying that it's brainstem and start calling it spinal cord? And the answer is at the foramen magnum. Once the brainstem exits the foramen magnum of the skull, at that point we begin to call it spinal cord. So foramen magnum of the occipital bone, occipital condyles of the occipital bone. Now on the external view, if you look where your temples are, your headache spot if you will, that's actually the sphenoid. This is the sphenoid that's been taken out of the skull. So this whole thing is the sphenoid, and what you're feeling on the outside of the skull is this outer portion here and this outer portion here. But you actually only have one sphenoid bone. I could point to it from outside of the skull and ask you for this little area right here. And I would say, what is the bone? And you should say sphenoid. Okay, so just this little part here. The rest of the sphenoid, we can't really get a good appreciation for it until we take off the skull cap. So now that we've taken off the skull cap, we can see this kind of bird-like shape here with the wings. And I like to say it's the shape of a sphinx. Sphenoid is the shape of a sphinx. These would be the wings. This is the mouth. And these are the eyes. There's two little holes here for the eyes. This little chamber right here, this is the mouth, right? So I want you to think wine goes in the mouth and wine comes from the cellar. So think of wine goes in the mouth and wine comes from the cellar. So this is the sella turcica. Sella turcica of the sphenoid or sphenoid bone. Sella turcica of the sphenoid bone. Now, the sella turcica is a little chamber that actually physically houses the pituitary gland. Now, the pituitary gland lies at the base of the brain, and its primary function is to secrete human growth hormone. People that have tumors in this area suffer from something called gigantism, and these are the tallest people that we have in the world. The sella turcica houses the pituitary gland. It's the sella turcica of the sphenoid. Now, the eyes of our sphinx are here and here. Now, I can go ahead and put my stick all the way through, I think. I should be able to. There we go. Both of those are the optic foramina. The optic foramina of the sphenoid bone. The optic foramina is where the optic nerve is going to go through the skull to get to the brain. The optic foramina. So I stuck my stick through the hole here. Let's see where it comes out on the other side. If I go straight back, that's the optic foramina of the sphenoid. The next one I want to talk about is the ethmoid bone. From this point up, the top 2/3 of the nasal septum is the perpendicular plate of the ethmoid bone. Perpendicular plate of the ethmoid bone. Now, if I continue to go up into the sinuses, I get to the other side of the ethmoid bone, which is here. Now, there's two structures here that you need to know for the ethmoid bone. There's this little crest, if you will, that sticks up. So there's one little thing right here in the center that sticks up that you can feel with your finger. This structure is called the crista galli. The crista galli. Crista galli of the ethmoid bone. Now, crista galli means rooster's comb. So this is the crista galli of the ethmoid bone. On either side of the crista galli, I have these little holes. I've got them on this side and on this side. And I could point at either side. This is the cribriform plate of the ethmoid bone. Cribriform plate of the ethmoid bone. Now, what this is, those tiny little holes are passageways for the olfactory nerves to go through the skull and enter the brain. The olfactory nerves carry the sense of smell. Think of old factory kind of smelling. So olfactory is the sense of smell. The way that I like to think about this one is I think of if you're babysitting and the crib smells, then the crib needs to be reformed, right? So crib, reform, stinky baby, sense of smell, which is olfaction, okay? So crib, reform, plate. Cribriform plate. All right, so now let's go over some structures of the facial bones and some of the bones themselves. The main bone of the face is the maxilla. The maxilla is going to go from here. You'll see a little suture right here. All of this towards the nose. The top lip area here, okay, it's going to go all the way up to here where we have our nasal bones. and all the way here. Okay, so all of this area here is maxilla. Maxilla. Usually around this time in the lecture is usually when you might start feeling like you're welling up with tears. So it's only appropriate that we now go through the lacrimal bone. Now the lacrimal bone is the only bone you are responsible for that's inside the eye orbit. This right here is the lacrimal bone. Lacrimose means sad. So the lacrimal gland leads to the tear duct. So this is where your tears come from. Lacrimose means sad, think tear duct. And your tear duct, you can actually see it right here. The tear duct is right at the base of the lacrimal bone. Lacrimose means sad, think of tear duct, okay, lacrimal bone. And it's just this little tiny portion right here. These bones here are simply the nasal bones. When you get punched in the nose, if you break your nose and get black eyes, then you've broken your nasal bones. And hopefully you can see why that is, because, I mean, look at the association and where they're at. They're right there. If you look real closely, there's a suture right here, and there's another suture right here. This portion is that poofy part of your cheekbone. That poofy part of your cheekbone. This is a zygoma or zygomatic bone. Zygoma or zygomatic bone. The structure that you need to know is the temporal process of the zygomatic bone, which is right here. And it's called that because it's pointing towards the temporal bone. So we have the zygomatic process of the temporal bone, which is here, and that's going to articulate with the temporal process of the zygomatic bone. Both of those structures together are known as the zygomatic arch, and when you feel your entire cheekbone, that's what you're feeling. You're feeling both of those. So your whole real, like what we think of as our cheekbone, only the first part is actually the cheekbone, the zygomatic bone, and then the rest is actually temporal. Okay. But together they make what we feel as our arch, our zygomatic arch. There's one structure for the jawbone that you need to know, and that is right here. This is the mandibular condyle. Remember, condyle means knuckle. So this is the mandibular condyle of the mandible, and that is going to make contact with the mandibular fossa of the temporal bone, which is up here. Mandibular condyle of the mandible. So another one of the bones is in kind of a weird spot, but we have two different views of it. One view is here, and this is the lower 1/3 of the nasal septum. So your nasal septum is actually made up of two different bones. This lower portion from where it has this little notch down is called the vomer. V-O-M-E-R. All right, so the vomer. Interestingly, we only have one vomer. It's a thin, weird, rectangular type of plate. And let me show you where the rest of it is visible. Okay, right here. See this thing right here in the middle? That is the vomer. So this is without the jaw. You can see it a lot better. All right, so here, that's that bottom view of the vomer. Okay. The posterior 1/3-ish of the palate is the palatine bone. So this is the palatine bone here, the palatine bone. Interestingly, anteriorly, so all of this is no longer palatine bone. This is actually part of the maxilla, which makes up most of the face. All right, so vomer, palatine bone, and that's part of the maxilla. And that's it for the skull. These are the clavicles. Okay, these aren't the collarbones, these are the clavicles. This is the breastbone. This is called the sternum, the sternum. What I'm going to ask you in the articulated skeleton, or at least the articulated rib cage, is just what type of rib is this? So let me show you how to answer those questions. So there's 3 types of ribs: true ribs, false ribs, and floating ribs. Our first rib is actually way up here. So this is rib 1, 2, 3, 4, 5, 6, 7. The first 7 ribs are called true ribs. Now the reason these are called true ribs is because the true ribs are said to have a direct connection to the sternum. Okay, so the first 7. have a direct connection to the sternum, so we call them true ribs. We have 12 pairs of ribs. Now, rib pairs 8, 9, and 10, so the last three here, rib pairs 8, 9, and 10, are called false ribs. Now, the reason that these are called false ribs is because they actually have to merge with number 7 in order to reach the sternum. So we say that this has an indirect connection to the sternum. An indirect connection to the sternum, making them false ribs. False ribs. Okay. The last type of rib is a little bit easier to understand. This is rib pair 11 and 12. Now these ribs, do you see that? I'm wiggling it. See how it's not connected to anything? Right there and there. They're not connected to anything. So for that reason, we call ribs 11 and 12, we call those paired ribs floating ribs. And they're called floating because they do not connect at all with the sternum. This is the breastbone called the sternum. I like to think of a stern, old-fashioned 1950s man wearing a suit and tie. And it actually kind of looks like a tie if you look at it. Think stern. A stern old man, sternum. There's a very slight indentation here at the top. This is called the jugular notch. The jugular notch. Jugular notch of the sternum. The next structure is this whole kind of the knot of the tie, if you will, up here at the top. This is the manubrium of the sternum. Manubrium of the sternum. So the manubrium of the sternum, jugular notch of the sternum, way up here. From here to about here, all of this is the body of the sternum. When we use the body as something, it's kind of the main, biggest piece of the structure. So we call this the body of the sternum. Last but not least, this little nub right at the end, this is called the xiphoid process. It's spelled with an X. So it's the xiphoid process. Now, one of the things that is dangerous about the xiphoid process, this can snap off relatively easily. Now, if you have any training whatsoever, like actual training of how to do CPR, you really don't need to worry about breaking the xiphoid process because you have to be considerably in the wrong area to do CPR to do this. But and it doesn't happen that much anymore because people are so happy, but it used to happen quite a bit where people would be out and there would be some type of emergency situation and they'd be like, well, I've seen Grey's Anatomy from the first season, so I know how to do CPR type of thing. I've seen it on TV, how hard can it be? The problem with that, if you are way off, one of the things that can happen is the xiphoid process can snap off relatively easily. The problem with this is that behind here we have the solar plexus. The solar plexus is a bundle of nerves that controls a lot of the autonomic functions of your visceral organs, of the organs of that area. So that can be lethal. These are the costal cartilages, C-O-S-T-A-L, the costal cartilages. When we use the word costal, costal means of the ribs. So we're going to find out when we do muscles, we've got intercostal muscles. So costal cartilages. We also have just the sternum by its lonesome, jugular notch of the sternum, manubrium of the sternum, body of the sternum, and xiphoid process of the sternum. All right, easy peasy. In a practical exam, the first question you want to ask yourself on the practical exam is, what is the level? You want to figure that out first. So the first thing that you're going to want to ask yourself here is, does it have transverse foramina? These here are transverse foramina. They lie in the transverse or horizontal plane. So these are transverse foramina. Remember, foramina means holes. Transverse foramina. Now, if it has transverse foramina, then it has to be in the cervical region. So let's say you're in your practical exam and I'm asking you what the level is. So first thing you want to ask yourself is, does it have transverse foramina? If it does, you know it's in the cervical region. But don't stop there, because in order to give full credit, if it's C1 or C2, it's not enough to put cervical. The next thing you need to do is it C1 or C2? So I've decided, okay, I've got transverse foramina, and now let's figure out if it's C1 or C2. Now C1, let me grab one here. This is C1. This is the atlas, ATLAS, the highest cervical vertebrae. This is the body of this vertebrae. The atlas is the only vertebrae that does not have a body. So this is the body here, and there's no body. So it ain't got no body. It ain't got no body. No body. So if it has no body, then you know, okay, has to be the atlas. Okay, let's say that it's not that. Is it C2? All right, let's look at C2. What does that look like? C2 has so much body, it's got enough body for C1 and C2 together. So this has this phallic thing here, this teeny weeny weeny, and this actually acts like the body, but it actually acts like the body of C1, and it articulates like so. And then on top of this, the occipital condyles are going to sit right on top of C1. If it has no body, it's the atlas, C1. If it has such a big body that it has body to share, then it is C2, which is the axis. Interestingly, the axis allows you to shake your head no, and the atlas allows you to shake your head yes. This is the only vertebrae that has this structure. Okay, it's not called the teeny weeny weeny, even though you're really going to want to put that on the practical exam. This is the dens, D-E-N-S, D-E-N-S. Okay, so this is the dens. It's the only one that has the dens. So you're on your practical exam, you're trying to figure out the level, and let's say that it's not C1, it's not C2, then you're safe to just put cervical for the level. Now, what if it doesn't have holes? If it doesn't have holes, then you only have two choices. Your choices are that it's either going to be thoracic or lumbar. There are two fun ways to tell. One of the ways to tell is that, do you see these are kind of like horns? So in the thoracic region, I have 3 horns. 1, 2, 3. In the lumbar region, I have 5 horns. Let me point those out. 1, 2, 3, 4, 5. See that? Thoracic has 3. 1, 2, 3. Lumbar has 5. 1, 2, 3, 4, and 5. If that's not enough, another way to tell is by looking at the spinous process. All right, the spinous process of the lumbar region is very rounded. It looks like, I call it a moose horn. Okay, it looks like a moose horn. Whereas in the thoracic region, it's pointy, long and pointy versus moose horn. For the cervical vertebrae, this is the body. And if you wonder what the body is, when you look at the articulated skeleton, I've got body, intervertebral disc, body, intervertebral disc. Okay, so the body is what's stacking up on top of one another. All right, so here is the body. These are only in the cervical region, and these are the transverse foramina. Transverse is horizontal. It's the horizontal plane. So transverse foramina. These little tiny things here and here, they're super small in this one, but here and here are the transverse processes. Okay, transverse processes, finger-like projection, right? Okay, so we've got our transverse foramina and then the transverse processes that are going out horizontally to the sides. I'm giving you guys a little bit of a break when it comes to these here. You can simply refer to them. We actually have 2 on top and 2 on bottom. We have 2 superior articulating processes and 2 inferior articulating processes. All I want from you is articulating process for articulating processes, either one. Because if you look at the bodies are not connected to the other vertebrae directly. They have the discs in between them. But they do make contact at the articulating processes, above and below, here and here. So articulating processes, these flattened things here and here. We have a big hole in the middle, of all of our vertebrae. And this is the vertebral foramen. Vertebral foramen. Foramen meaning hole. This is the hole that the spinal cord goes through. The last structure you need to know is the spinous process. Now the spinous process in the cervical region is really short, but that's all of these. When you rub your finger down the back of the spine, all of these are spinous processes, and they get bigger as you go more inferior. Spinous process. Those are the ridges you feel in your back going straight out. Okay, let's look at those same structures in the thoracic region. In the thoracic region, here is the body. Here is that vertebral foramen. These, as strange as they look, these are the articulating processes. Articulating processes are here. These are the transverse processes. So articulating processes, transverse processes, because they're going out to the sides. Okay, and then the big one here is the spinous process. Spinous process. For the lumbar region, this is the body. This is the vertebral foramen. This is the spinous process. The transverse processes are going to be the ones most horizontal, most out to the side or transverse. The ones on the ends are the transverse. Okay, horizontal, out as far as they can be. Transverse process, articulating process, and spinous process. And for completeness sake, it is possible that you might just get this thing. This is the sacrum. If this shows up on a practical exam, it's simply going to be, what is this bone? And then we have the coccyx. Okay, so usually the coccyx is the tailbone, and usually it would be like so. The sacrum and the tailbone would connect like so. Okay. Unarticulated. So, and the way you can tell what this is, it looks like little pyramids. It's like tiny little bones stacked up on top of each other. So they're kind of cute.